These are the MRI scans of the next patient. She is 59 years old. These are 3 Tesla MRI images. Actually, there are 3 films here and there is one more over here. So let's have a look at the 3 Tesla MRI. I've talked at length about the importance of getting a 3 Tesla MRI for OA cases. And we'll start with this. We can see here in this that there is a fluid collection here in front of the knee. This is the suprapatellar pouch, and you can see with the arrow that that fluid collection has been arrow-headed here. There's a fluid. This is a fluid collection, and here also there is fluid collection. There's probably a loose body here in this outer aspect of the knee, and this is the cartilage. This is the outer side of the kneecap. You can see that there is an irregularity in the kneecap cartilage in the outer half. That is the lateral compartment. Medial compartment, we can see this arrowhead is showing an osteophyte. Osteophytes are bony spurs and the cartilage is lost. Then we come to the coronal sections of the knee. These are the thigh. This is the thigh bone and this is the leg bone. And these arrows indicate, this arrow is indicating intraosseous or subchondral edema. That means fluid collection underneath the cartilage. This is the outer half of the knee, and there is subchondral edema over here. And same thing on the inner side also, there is subchondral edema in the left knee. The meniscus is absent, it is degenerated. This is the outer side meniscus, it is there. But again you can see with the arrowhead that there is a tear in the meniscus. This white portion is a intra-substance tear of the meniscus. Here the meniscus or the C-shaped cartilage is attenuated or thinned out and displaced. So the meniscus is absent, and when we go to the back of the knee, this is the back of the knee. Here the meniscus root is damaged. The ligaments are missing over here, and here we are seeing in the middle of the knee, outer meniscus, there is a cartilage, that is there is a swelling inside the outer meniscus, that is a lateral meniscus. Medial meniscus is thinned out. So these are the findings in the coronal scan, and these are the sagittal scans. We see here there is a fluid collection in the suprapatellar pouch or in underneath the kneecap over here. This fluid collection is outlined here, and there is a bone spur here as outlined here. Then this is the inner side of the knee, medial side or inner side. We can see that the front of the meniscus, there is a tear there, and the cartilage from front to back, it is missing. Normally the cartilage would be grey color, but it is thinned out here. So grade 4 chondromalacia on the lower end of the thigh bone and on the inside. And as we come to the outside, the cartilage is spared, and this is the outside of the knee. The meniscus is intact here. Here the meniscus at the front is worn out. This is the center of the knee where the cruciate ligaments are supposed to be there, anterior cruciate and posterior cruciate. The posterior cruciate, there is edema here. Normally it should be black, but you can see white over here. So there is edema of the posterior cruciate ligament. What else? So these are the MRI, and then this is the kneecap from the top to the bottom. So these are the sections of the kneecap here. This is somewhere in the middle. This is the inner part of the kneecap. This is the outer part of the kneecap. If I zoom in over here, you can see the grey color cartilage is there, but on the outer side of the kneecap, it is thinned out. It is missing here in this area exactly, and here it is present. So in between here and here, the kneecap cartilage is missing. So this is grade 4 cartilage loss under the left kneecap. Again, you can see here there is a white edema in the under the kneecap. So grade 4 cartilage loss. So this lady in summary has got grade 4 cartilage loss under the on the inner side of the knee medial compartment, as well as grade 4 cartilage loss under the knee cap, and bone edema over here on the outer side as well as on the inner side. So she has got disease involving 3 compartments of the knee. So I'll be injecting SVF into the knee and also into the surrounding bones. So this is the importance of getting 3 Tesla MRI scans. I'll also show you the cartogram. I've talked at length about the cartogram. This is the 3 Tesla cartogram of the left knee. Cartilage mapping has been done here. You can see here where their markings are there. From the top, there's a scoring system assigned to this, and you can see all these points from front to back where they have done a scoring. Here also you can see the scoring here. So many points the radiologist has reported. Here you can see again the scoring system over there. Those points are all areas of cartilage loss, and we have seen that on the MRI findings. This 3 Tesla MRI is very, very useful because we have seen the intraosseous edema, the bone swelling within the bone, and we are also able to see in a very graphic and detailed manner areas of cartilage loss which have all been marked out, so we can identify exactly where the cartilage loss is present. And this is the baseline investigation. I'm going to do PRS injection to this lady today, 59-year-old lady. We'll talk about her clinical condition later. She hails from Tamil Nadu. She doesn't have any diabetes, but probably she might be having insulin resistance. I will be talking about the insulin resistance also. She has got involvement of not only the left knee but also the right knee, but she's having the treatment for the left knee now. Yesterday when I was seeing her in the clinic, in my office, she had complaints of tenderness over the left wrist. That is, there is osteoarthritis of the left wrist joint also, and left shoulder joint also, and also lower back. So obesity is a risk for osteoarthritis. She is only 59 years old and she has developed osteoarthritis. We'll be talking at length about obesity as a risk factor, how it affects articular cartilage. And so we have seen here now that obesity has led to osteoarthritis under the knee, and I'll be performing PRS injection to the left knee today in theatre. This is the second case for today. Thanks for watching. Hope you found this information useful. If you found this information useful, share it with a friend or relative who might be suffering from osteoarthritis. Subscribe to my channel to see more videos. I'll see you in another video. Cheers.